Hello all and welcome to episode 9 of Dialogue with Director. We have seen principals, we have seen teachers, we have seen students and so many people. Today we have a different kind of guest, and recently they have done a collab with the department on yoga initiatives in Shillong Public School. So that's why we thought it's very important that everyone should know about it. So today's guest is Dr Emidaka Dkhar. She will let her introduce herself because so much about her. So I want you to introduce yourself.
Yeah, okay. So firstly, thank you very much, sir, for having me in your show. A bit about myself is, my name is Dr Emidaka Dkhar. I'm born and brought up in Shillong itself, and I finished my UG from Karnataka. I specialize in yoga and naturopathy. So a little bit about that. It's a course in Ayush. So in Ayush itself, we have A for Ayurveda. So I am technically the Y of Ayush, you can say. So yoga and naturopathy. So we focus a lot.
What is naturopathy? Because many people might not know that.
All right. So naturopathy basically means, in simple terms, nature cure. All right. So it's a completely drugless approach towards health. Okay, so we have a lot of lifestyle related conditions now, lifestyle related disorders that are rising up in the country now, and a lot of them, a lot of cases are reversed. Say for example, PCOD conditions. Then we have type 2 diabetes conditions also that are being reversed just by going and reversing the lifestyle in terms of timing, food timings, quantity, portion control, then a bit of yoga, basically movement, small and gentle movements on the body itself, because a lot of people who experience lifestyle related disorders, a lot of them, the most common habit that they have is they do not move much. Okay, their lifestyle is very sedentary, so they normally sit on a table, desk jobs, and they wake up in the morning, they get ready, they go to work, and then come back home and sleep. It's just a cycle, and this cycle keeps on going on and on and on for years together. And then what starts to happen is they start having a lot of issues with their back. The first and most common area of their body that gets affected the most would be their back. They start having lower back pain. So a lot of my patients come to me and then they're like, okay, I'm just 26 and I'm having lower back pain. Now what do I do? And then most of them, they get so scared. They're like, what am I supposed to do now? Am I supposed to go for surgery? Am I supposed to take some tablets, some muscle relaxants or something like that, right? So they always opt for something that is medicated, because they think medication is always the key to a lot of health related issues. But then now we need to, that's my personal view, okay, from what I've seen and my experience. I've dealt with a lot of type 2 diabetes cases and a lot of cases related to PCOD, obesity, then hypertensive cases as well. And majority of them, they really lack mobility in their day-to-day activities. 1, 2, their eating timings are very irregular. Then the third would be their sleep. Majority of the people don't get good sleep. It's always very disturbed. So yeah, and you can say that's where I come into the picture, where I guide people and I take consultations with them to correct their lifestyle, you can say. So what we do is we do something called diet prescription. Okay, so it's not really a medication prescription, it's a prescription where we tell you how much quantity of food to have in a day based on your BMI. Okay, that's one. The second thing is we prescribe specific asanas or postures or even breathing techniques, okay, that you can practice at home before you go to sleep or when you wake up in the morning, whatever's convenient for you, and a bit of mobility movements, you can say, followed by breathing techniques in your day-to-day activities. Say for example, you're free from for 10-15 minutes and you don't know what to do, so you decide to use your phone. So instead you can do a bit of breathing techniques with a lot of a bit of movement for your neck. Okay, so that can also help. So basically this is where I come into the picture.
Okay.
So yeah,
so as you said, sedentary lifestyle.
Yeah.
So walking is one of the good things.
Yes, walking is actually really, really good. It's really good for your cardiovascular system. Okay. Why? Because when we're walking, we're really pumping the heart. One, two, we're really activating a lot of the muscles on our legs. Say, for example, your calf muscles, your plantar muscles. Okay. And along with that, your hamstrings and your knees. Okay. Because once again, now rising cases of lifestyle related disorders, a lot of people have knee pain, and yeah, so coming back to the question, yes,
Walking is good.
yeah, walking
so
is
Shillong
good.
people, if you're listening, we have started an initiative, Walk Shillong, Walk to Work Wednesdays, and there is a club also now, which is Shillong Walking Club. So as doctor has said, walking is good. So of course, our aim is also health plus to reduce the congestion in the city, but it has multiple benefits. So walk Shillong.
Yeah.
So coming to the next, you are a student of Pine Mount.
Yeah.
So tell us a little about your schooling days.
So I did my 11th and 12th in Pine Mount School. So I was an ISC science student. So yeah, my time in Pine Mount was pretty short, but it was really good. Yeah, I had a very good experience. The friendships that I've gained from Pine Mount till now, I'm still friends with them. So yeah, my experience in Pine Mount was pretty good. Yeah.
But how was all the schooling? Your previous school, and how was
Okay.
the overall schooling?
You can say my schooling was pretty much average, maybe above average. I was not, a topper of the class, or I wasn't really, a first rank holder. I was just, 75% student. But, I really had a liking towards yoga since the time I was in class 9, class 10.
So you had a yoga instructor in school?
No, we did not actually. I actually practiced with one of my yoga teachers in Aurobindo once.
Okay.
So that was just for a very short period of time. I was exposed to that, experience of yoga for a while. And yeah, that's how my liking started, moving forward.
Let me put it this way. What did you learn in school? What are the, let's say, 3 things you learn during your schooling years?
Okay, the 3 things that I've learned. Okay, number 1 would be to be grateful and thankful. Okay, so a lot of the teachers when I was in school, they always, because from my kindergarten till I was in class 10, I was from Loreto. So they really taught us how to be grateful. So thanking teachers, thanking parents, thanking our friends for the smallest deeds that, for the smallest deeds and efforts that our friends and family did for us was something that I learned. And then the second thing would be to say sorry and to accept, mistakes that we've made, and not to, point fingers at others. If we've made a mistake, just accept it and move on. Talk about it with your friends and move on. Okay, so it was like that kind of relationship that I had in school. And yeah, I think because of that, it really helped sculpt my personality. You can say when I was in college, I was always very thankful and grateful to all my professors and my medical officers when I was in college. And then my friends started asking me like, why do you keep saying thank you, or why do you keep saying sorry? So I started understanding, the root values when I was in school, and yeah, it was like that.
Great. So looks like you had a very good teacher.
Yeah, I did.
You've done Bachelor in Naturopathy and Yogic Science.
Yes.
So there are a lot of young listeners to this podcast.
Yes,
mostly in school, mostly in higher and colleges also.
Yeah.
So they would like to know what is this and from where they can do it and what are the career prospects in this.
Okay, so I did my bachelor's in, like you said, naturopathy and yogic science, which basically means that it's a 5.5-year course that is under the Ayush ministry. Okay, so in this you have to appear for your NEET exam. Okay, you have to crack that. Then after that, you can definitely opt for different colleges all over India. There are a good amount of colleges. I was fortunate to pass out from one of the first and one of the best colleges in India in general. So I studied
Which is
in SDM, College of Naturopathy and Yogic Science. Okay, that is in Karnataka. Okay, it's in a small place in Ujjire, Dharmasthala. So I studied there for 5.5 years. I did my college there. I did my internship in Karnataka as well. So I gained a lot, in the whole process of college life. Because just to talk a bit about the course. So in the first, it's a total of 5.5 years course. So we have 4.5 years of academics and 1 year of just internship. Okay, so in the first year, we have subjects like anatomy, physiology, biochemistry, yoga, and nature care, meaning naturopathy in general. Okay, so in this, we have to really focus. We had to really focus on anatomy and physiology, because they are actually what form our base when we go for third year and final year. Okay, so that was it's actually 1.5 year course. Our first year was 1.5 year, because anatomy in general was really important for us, because we had to go very much in deep into upper part, the upper part of our body, lower limb. Then we had our head and neck, so it was very it was very intense, you can say. So yeah, then we had physiology along with anatomy, biochemistry, yoga and nature care. Then in second year, we had subjects like microbiology, pathology, forensic medicine. Then pharmacology. We also had chromotherapy and magnetotherapy, which is a subject that falls under nature care. So in that, we studied a lot about how colors have a very big impact on our psychology, and along with that, how it has a very big impact on our body in general. Say for example, the most easiest and simplest example I can possibly give you would be in cases of insomnia. So a lot of people have a lot of issues with sleep in cases of insomnia. So what we did was, we used to give blue light therapy. Okay, that is focused on a specific body part. All right, so that's normally the frontal part of the head. Okay, so we would expose blue light in the frontal part of the head for at least 15 to 20 minutes, and in the process the patient would just sleep or maybe relax without using any gadgets. So that's what we did in chromo. And magnetotherapy, on how we used small magnets of very light energy. Okay, that was worn in the body in forms of bracelets, in forms of a necklace or something like that. So that would probably help the imbalance of the magnetic waves around the body. Okay, and then we also had yoga, which was very important. So in fact, yoga in second year was actually one of my favorites, because it focused more on psychology and the philosophy of yoga, and how when you combine both of them, they really help you clear the channels that you have in life. Say for example, how you tackle with your daily life situations, whether how you handle stress, how you handle emotions. It really helped me when I was in second year. Then slowly coming into third year, we had very interesting subjects like nutrition, diet and nutrition. Then we had psychology. Then we had emergency medicine. Then we had modern medicine, which was how to deal with emergency cases. Then we also had a lot of other yoga. In third year actually, we had very advanced yoga. So we had to perform a lot of advanced techniques and very advanced postures, like Shirshasana, meaning standing on the head, and like a lot of that. So it was very interesting. It was fun.
Good that you remember all the subjects, because I don't remember.
Okay, yeah.
Because something maybe I did engineering.
Okay.
Now I'm not at all interested, so I don't remember anything which I studied.
Okay.
But it's good. So the point here is that you should study what you love. This is for all the young students. So what are the career prospects in your after doing this bachelor?
All right. So you can work. Firstly, you can work as a medical officer in naturopathy and yoga hospitals, in holistic.
In Meghalaya, are there opportunities in this?
Yeah, definitely.
In
I guess
hospitals and all that.
Right now,
we do have Ayush doctors.
We do have Ayush doctors, but at the moment they have not been. They have not really opened a post for a yoga naturopathy doctor yet. Okay. But in the state there are quite a number of doctors that have actually graduated from this field, and then that's one thing you can do. You can also work as an acupuncturist. Okay, because we specialize in acupuncture as well. So the next you can work as a wellness and mental health expert like me. Okay, so that's pretty fun. And then you can also work in holistic hospitals, meaning in simpler forms, integrated hospitals, where they have all forms of medicine that are in the same hospital, be it all streams of Ayush and allopathy medicine. So when a patient comes and they assess the patient based on the patient's body type, they'll guide the patient on which stream of sorry, on which stream of medicine to actually go for, which body type is, suitable for which field. So it's
Great.
like that. So they can also go for, they can specialize in nutrition as well. Okay.
Okay.
So we also,
We do have nutritionists in
yeah.
civil hospitals.
Okay.
That's great. So you have started something called YONA Wellness.
Yes.
So are you a doctor or an entrepreneur?
I am.
Or both?
I am both. I mean, I am part of both worlds, you can say.
Okay.
I mean, I'm still. I just finished my internship, and now I honestly didn't want to, sit at home and just work from home. I wanted to start something in the state, because in other states they definitely have a lot of naturopathy and yoga doctors that are, out there working, but like in the state there are not that many. So I really wanted to, help kids, in terms of finding which field they're actually interested for, because a lot of them feel like, if I don't get into medical, it's the end of the road, like, it's nothing's going to happen for me from here. Or if I don't get into engineering, it's just going to be the end from there. But I also want to, give a message to all the kids out there. If you really are interested in medicine, you should definitely explore, the different forms of Ayush. I think I learned a lot. It helped me a lot in my personal growth. It really helped me, come out of a lot of hard times just by, practicing yoga, just by channelizing my emotions, just by, focusing on my mental health. It really helped me in general. So yeah.
Great. So mental health, yoga, and schools. Basically, what is the relevance in schools, and how early we can start that, and is it being done now somewhere? Yeah.
Is it being done now somewhere? I'm not very sure about that, so I wouldn't really have any comments.
Yeah, but what's the relevance?
Okay, the main relevance is that, it's very, very important to be able to help kids in terms of stabilizing their minds from a very young age. Okay, so being able to practice yoga, if they get a chance to start practicing yoga, just not even movement, I would say, just slow breathing techniques is just more than enough for the kids. Just, before they start their classes, it helps to cool their mind, because, once again, yoga has a very therapeutic effect. It has a very scientific approach. So whenever I talk about yoga, I always have a backup of a lot of research-based papers. Okay, so why we should include yoga for young kids is because it has a very strong effect on our parasympathetic and sympathetic nervous system, which basically means that they will be more aware of whatever they're doing. Okay, so their state of being very mindful and being very aware about what they eat or how they walk, or what they're doing, will be very, very good. They'll be more stable. Okay, so that helps them when it comes to studying. It'll help them be more stable, be more calm, and they won't be exposed to a lot of stress in the long run. Okay, so that can really, really help them, because it'll also help them control the rate at which anxiety cases are rising and depression cases are rising. So that can definitely help them if they start from a young age.
Great. So you recently did, in fact, just before this podcast, you did a program with Shillong Public School,
Yeah.
and I attended some part of it on the first day.
Yeah.
So how was the experience, and what do you think? I mean, how can we make it better, and what was the feedback from the students?
Yeah, to be honest, I had a lot of fun. It was my first time working with so many kids. I mean,
How many were there?
I think around 500 kids were there. So that was like a very big number for me, because I'm very used to working with just patients and above 35 years of age. So having kids was a very, fun experience for me. They had a very positive feedback. I mean, they just told me to come back next week. So yeah, that was very, it was very, heart touching for me.
What exactly they liked about it?
They liked that, they could experience yoga in a very different perspective. Because when we talk about yoga, people just think about, okay, I'm going to do a posture. Okay, but we're taking a yoga mat, so we're going to do some standing postures, or we're going to do some, sitting postures, or something like that. Or we're probably going to do some form of meditation. So this style of portraying yoga is very, very different. And that was my goal, to reach out to kids and explain to them that yoga is not always about postures, it's not always about meditation, it's about slow breathing. So which once again, I'd like to mention this: how is yoga very different from other form of physical activity? This is a very common question that people really don't understand. So yoga is very slow. Okay, so you'll definitely get more benefits if you do it even more slower with breath control. Okay, whereas if you talk about any form of other physical activity, it's very fast. Okay, and they just nobody really tells you to breathe correctly. So my goal for this small workshop that we had here in Shillong Public School was, number one, to teach kids how to breathe. Okay, so different types of breathing. I did include the happy eye yoga, which they were very happy. Then the second thing was, I wanted to teach them about something called clavicular, thoracic and abdominal breathing. Okay, so how these type of breathings can really have a very big impact on your digestion, the way you think, the way you react. Your reaction time towards a specific stressor will also change. Then I also wanted to show them a bit about the different types of breathing techniques and how to control stress and how to control any form of anxiety related condition. Okay, and the last thing that I really wanted to focus on was a lot of there are a lot of rising cases of heart attacks now, and a lot of rising cases of higher hypertension. Yeah, exactly. So a lot of blood pressure, meaning hypertensive cases, are also rising. And what I wanted to explain to them, and what I actually did, was I taught something called hand stretch breathing. Okay, there is something called hand stretch breathing where you do it very slowly, you do it very rhythmically, and it has very strong impact on your sympathetic nervous system, and that really helps reduce your blood pressure over a period of time. So the slower you can do it, even if you do it for like 10 to 15 minutes in a day, that's enough for you. Because once again, at the end of the day, it's all about controlling the cortisol production in the body, and how we can increase the dopamine and all the other endorphins and serotonins in the body. So yeah.
Great. Should yoga be made a part of the curriculum in schools?
Yeah, I think I definitely feel that yoga should definitely be a part of the curriculum. Yeah, because it doesn't necessarily have to be a proper movement. It can just be done in the classrooms. It can be done in a very modern fashion. It doesn't have to go traditional. It can be very modern. It can be very scientific, and it can be very short and very effective. So that's something that I feel the schools should really include for the upcoming sessions. So yeah.
Career advice to students?
Yeah, I would suggest you should really listen to your gut, because once again they say your gut is your second brain. If I mean, there are once again research papers based on that. So your gut is your second brain. Okay, there is something called gut brain axis. So I feel whatever makes you happy, okay, you should definitely go for that. But once again, make sure that it's very practical for you. Okay, it should be practical for you enough so that you can approach it in a very clear form. And make sure that in the process of you learning, you shouldn't be drifted away from what you actually want to do. So yeah, that's about it.
Lastly, there's some misconception about yoga.
Yeah.
Like people feel that there is some religious connotation to it, and
Yeah.
all, especially here, and then
Yeah.
that is why they were a little hesitant sending their kids
Yes,
for this.
yes.
So you want to clear the air on that?
Yeah, I really do. I mean, yoga is not a religious sort of practice at all. It is a very scientific, it is a very therapeutic way of life. In fact, yoga is a way of life, because once you start inculcating it in your lifestyle, once you start practicing it every single day, you'll really feel the difference. You'll really feel like your days get better with time, and your reaction time towards a lot of situations start getting better. You start thinking very practically and very slowly, and it's just really therapeutic and very scientific. So I mean, there are so many research papers that are being published, that are being studied right now, and that says that, you know, yoga has so much of a very profound effect on the body. So I definitely feel that, you know, if kids get a chance to practice it in their day-to-day activities, in their curriculum, I think that'd be really, really good for them. So yeah.
Thank you, doctor, for coming here on this podcast
Thank you so
and
much.
sharing all these thoughts. So, all the schools and principals who are listening, this yoga is a wonderful thing, and we have seen recently in Shillong Public School and the reaction of the students, and will continue to do similar programs. If you are interested, you can also reach out to all these organizations who are being involved in this promotion of yoga, and we will definitely work on bringing it in the curriculum, and so many things we have to introduce in the basically curriculum to make it interesting, because the co-curricular activities are equally important other than the syllabus. So I look forward to more such schools coming out. Similar initiatives are being taken in chess also. We have asked all the schools to make chess clubs. Now, for health and wellness and sports also, we encourage all the schools to take similar steps. So that was all for this episode. If you know more people who are doing great work in school, in education, let us know, and we'll bring them here, and we'll listen to their thoughts so that everyone can know about all these good initiatives. Thank you so much. Kuble Shibun, Mithila.